You know, I've always been kind of a foodie because my dad was a chef at a restaurant, and so I enjoy eating, but I never learned the proper way to eat. I played football and I wrestled and I just ate because I was told to eat. And then I would get depressed and I would eat and I would be happy and I would eat, and I didn't know why. I just was still hungry all the time. I would literally cry myself to sleep hoping that maybe I would have a heart attack that night so that I would be done.
Sam is a tall guy. He's over 6 foot tall, but he also weighed 429 pounds. So his BMI, if you calculate that, is 56. So he falls in the category of super morbidly obese.
I had sleep apnea. I had high blood pressure. I had high cholesterol, and I was fighting, you know, to stay alive, and I was only 29 years old.
For me, as a surgeon, seeing that, it's kind of a no-brainer, if you will, that he needs serious help. But again, it takes a while for people to kind of realize, well, you know, I need that help.
My wife and I found out we were pregnant, and I just wanted to be here for her and my future children. And so I said, I got to do something or I'm going to not be here for very long. And doctors kept telling me, you'd be lucky to see 40. When I first started looking at the process, I had all of the different options laid out in front of me, and the gastric sleeve was the one that I thought sounded the most natural.
So the vertical sleeve gastrectomy, we take out the outer part of the stomach, and we remove somewhere between 75 to 80% of the stomach, and we leave behind a little tube. A lot of times people will say, well, did you put the sleeve in me? And we don't put anything inside patients. We just make a tube out of the stomach, and we call it a sleeve because it looks like the sleeve of a shirt. And what that does is it reduces the amount of food that people can eat.
Everything fell into place, and I had my surgery on June 3rd at 12 o'clock, and from there my life just changed completely.
I call the first year the honeymoon period, and they're losing weight, their joints get better, they're more active, they're not hungry during that time frame, and we're hitting them with a lot of education so that when the honeymoon is over, they're prepared for it.
So my original goal with this procedure was to just lose about 50 pounds, but I got down to 210 pounds, which is, 220 pounds lost. And really the only reason that I hit those goals and continuously hit them was because of following the program. If people are like, what'd you do to lose all this weight? I lead with, I exercised and I watched what I ate, and I, did the program that I was supposed to do. And they said, well, what's the program? And then I get into, well, I had surgery, and the surgery was just a tool to help me be able to lose this weight.
As a surgeon, I'm doing one part, but we have the dietitians, we have the exercise physiologists, we have the behaviorists, we have an entire team of people working to try to help the patient be successful.
The support that I got from the Grant Health Partners and through Mercy Health was just phenomenal. My medical issues now are all gone. I no longer have sleep apnea. High blood pressure is gone. My high cholesterol is gone. All of those are completely out of my life. I don't have to worry about them anymore. I'm doing things now in my 30s that I could never have done in my 20s. I couldn't have kept up with my daughter. There's no way. And the joy that I have in my life now with my family and the things I can do with my wife and my daughter are just so awesome for me. I've done a Warrior Dash, ran 4 or 5Ks. I did 2 triathlons last year, and these are all things that there's no way I possibly could have done it before. As an advocate for the program, I'd be like, go for it, because it's going to be the best choice you've ever made in your entire life. It's going to change your entire life around. You're going to have a whole new you, a whole new life, a whole new family, and my family is considering doing it now because I've done it.